Like when we have these discussions about healthcare, there's always an issue that we never really talk about, and it's the issue of stress. And a lot of us are seeing it now in our congressional districts because of the economic situation that we're dealing with. And the issue of stress leads to, I think, we know, increased illness. And, you know, these people who are losing their jobs, losing their health care, it has an effect. And I just want to ask, we had this conversation a little bit with NIH, the brain research on being able to regulate yourself and regulate your emotions and reduce your level of stress is significant. And so when NIH was here, I asked them specifically about doing more and more research on mindfulness, and Congressman Jackson brought up meditation and this mindfulness-based stress reduction. They've been studying this for 30 years at University of Massachusetts and different places across the country. And I want to know if you're familiar with this, if it is a part of your approach moving forward here, you know, the physiology of stress, the neuroscience behind it. This is a very inexpensive way to teach kids how to increase their level of attention, their attention span, their level of focus, how people who are dealing with chronic pain you mentioned earlier, and how you want that to be a significant savings, how dealing with chronic pain can be treated with this method as well. So just wanted to see if you were familiar with this and if there's any approach within the department to try to not only increase the research but increase the programming and the education of this.
Well, I'm certainly a bit familiar with it, but not nearly to the extent that you've just outlined. And again, I think it's a prevention strategy that I know has the potential of paying huge dividends. I've seen it used as a violence prevention technique with kids in school, you know, teaching various kinds of control methodologies. And you see violence levels rise with, as you say, folks becoming unemployed and the stress that is related to that. So I would just like to have the opportunity. We will have a new leader in the mental health area soon, and certainly it overlaps with health reform and work that we're doing with early childhood, and I just would like an opportunity to continue that discussion. Yep.